All right, let's dive into something pretty fascinating today, semaglutide. You're probably thinking, wait, isn't that a diabetes drug?
hmm
And yeah, you're right, but trust me, there's a lot more to this than meets the eye. We're going beyond the headlines, going beyond just diabetes, to really uncover how incredibly versatile this medication is turning out to be. And to help us do that, we're going to be taking a look at this editorial in the European Heart Journal. They're calling it a potential game changer, and after reading it, I can see why.
It really is kind of mind-blowing when you think about it. It's almost like, when you have that one tool that you think is just for one thing, like a simple Swiss Army knife, right? You think it's just for, I don't know, opening bottles and stuff. But then you find out it can make gourmet coffee, too.
Uh-huh, exactly. And the editorial actually uses that too good to be true kind of feeling to describe how semaglutide is evolving.
Yeah.
It started as a diabetes treatment,
Right.
but now it's showing potential in so many other areas. They even came up with a term for it. They're calling it the semaglutide efficacy nonette because, get this, it's shown positive results in 9 different areas.
9. It's pretty remarkable.
It's not just blood sugar and weight management. We're
Yeah.
talking kidney protection, even some types of heart failure.
And that's why I think it gets really interesting. One of the areas where it's showing the most promise is in protecting the heart and kidneys, specifically in people with type 2 diabetes who also have chronic kidney disease.
Okay, so before we go any further, can we break down CKD for a second? Like, for someone who might not be totally familiar with it, what exactly does that mean, and why is it such a big deal for people with diabetes?
Sure. So chronic kidney disease basically means the kidneys aren't functioning as well as they should. It's a progressive condition, meaning it gets worse over time. And unfortunately, it often goes hand in hand with diabetes. The big problem is that as CKD progresses, it significantly increases the risk of major adverse cardiovascular events. We're talking heart attacks, strokes, even death. And, those are already major concerns for people with diabetes.
Right, right. So CKD is a serious complication.
Yeah.
And is that where semaglutide comes in?
Yeah, that's where it really shines. The editorial actually dives deep into a study called the FLWO trial, and this trial specifically looked at semaglutide's impact on cardiovascular outcomes in people with, you guessed it, type 2 diabetes and varying degrees of CKD. And get this, the trial was actually stopped early
Oh, really? Why?
because the benefits they were seeing were so clear. It was actually considered unethical to keep the placebo group from receiving the medication.
Hold on. They stopped the trial early? Because semaglutide was that effective.
Yep, that's how significant the results were. They saw a really substantial reduction in risk for all those serious cardiovascular problems we talked about, the MEC events.
Bruh,
Fewer heart attacks, strokes, and cardiovascular deaths.
that's amazing.
They also found that semaglutide reduced all-cause mortality. So basically, people were just living longer overall.
That's incredible. But there's one thing I'm curious about. The editorial mentions that semaglutide was even more effective for people with more severe CKD. Why would that be?
That's a really interesting question. And to be honest, it's something researchers are still trying to fully understand. It could be related to a bunch of things, like how the drug interacts with the kidneys at different stages of CKD, or even how the body processes the medication differently when kidney function is more compromised.
That makes sense.
But I think the really encouraging takeaway is that the people who are at the highest risk are the ones seeing the greatest benefit.
I see. That is really encouraging. So, okay, we know semaglutide is doing a lot of good here, but I think it's time to talk about the how. Like, how is it actually working to achieve these amazing results?
Well, a lot of it comes down to its effect on blood sugar. I mean, that's its primary function for diabetes management. And regulating blood sugar is obviously crucial for overall health.
Right.
But it also helps lower blood pressure and promotes weight loss, which, as we know, are both great for heart health.
That's what...
But what's really interesting is that the editorial hints at something more going on.
Okay, now we're getting to the good stuff. What else could be happening?
Well, researchers are looking into whether semaglutide could actually be improving vascular health, and maybe even promoting the regeneration of blood vessels.
Whoa, hold on.
It's still early, but this could explain why we're seeing such a big reduction in cardiovascular risk.
So it's not just managing existing problems. It could actually be healing and improving the system itself.
That's the idea.
That's pretty incredible.
And there's more. The editorial also talks about how semaglutide is showing promise in other areas, too.
Oh, like what?
Well, for one, it's showing potential in treating obesity-related heart failure. And it's also looking good for reducing cardiovascular risks in people with obesity without diabetes.
Wait, back up.
Yeah.
It's showing promise, for people with obesity, even if they don't have diabetes.
That's right.
That's huge.
It is. It opens up a whole new world of treatment possibilities. And actually, the editorial makes it clear that semaglutide isn't working alone here. They talk about a formidable 4 group of medications that are all showing incredible promise for protecting the heart and kidneys in people with diabetes.
Ooh, a formidable 4. I like it.
Huh.
So who else is on this team?
Well, we have semaglutide, of course, and then there are RAS inhibitors, SGLT2 inhibitors, and nonsteroidal mineralocorticoid receptor antagonists.
Okay, so those are some mouthful names, but
Yeah.
what's important to understand about them?
The key is that they each work a bit differently. They target different aspects of heart and kidney health.
So it's kind of like using a whole toolkit to address the problem from every angle,
Yeah, that's a good way to put it.
instead of just relying on a single tool.
Exactly. And this really highlights how interconnected the heart, kidneys, and metabolic system all are. You can't just treat these things in isolation anymore.
Right.
It takes a more holistic approach that recognizes how they all influence each other.
It's like we've been trying to solve this complex puzzle by only looking at individual pieces. But now we're finally starting to see the bigger picture.
That's a great way to think about it. Exactly. And the editorial really drives this point home. They talk about how these findings are so important. They're basically saying, hey, medical professionals, we need to get semaglutide into clinical practice, like yesterday. It's
Yeah.
not just about some cool science. It's about saving lives right now.
Yeah, you definitely get the sense that they're pretty fired up about this.
Yeah.
It's not every day you see a medical journal with such a strong call to action.
I know, right? It really speaks to how significant these findings are. We could be looking at a completely new way of managing these complex conditions.
It's pretty amazing to think that all this started with a drug for diabetes.
Ah.
It makes you wonder what other hidden gems are out there. What other treatments are we overlooking that could have a similar impact across multiple health conditions?
You know, that's the million-dollar question. Semaglutide is a great reminder that our understanding of medicine is constantly changing. There could be other treatments with the same kind of potential, just waiting to be discovered.
It feels like we're on the verge of a whole new era in medicine. One where we're moving beyond just treating symptoms and actually starting to understand how everything is connected.
I totally agree. The more we learn about these connections, the better we can develop new treatments and ways to prevent these diseases.
It's all incredibly exciting, but let's bring it back to the listener for a second. Like, if someone is listening to this thinking, okay, this is all fascinating, but what does it mean for me?
That's a really important point. First of all, if you have type 2 diabetes, especially if you also have CKD, these findings should give you a lot of hope. Definitely talk to your doctor about semaglutide and whether it might be right for you.
And even if you don't have those specific conditions, I think the story of semaglutide is a great reminder that medicine is always moving forward. It shows how important it is to stay informed and advocate for your own health, and to have open conversations with your doctor about new treatments.
Absolutely. It also shows how important it is to take a proactive approach to your health. Things like maintaining a healthy weight, eating a balanced diet, getting regular exercise, those things can have a huge impact on your overall health and can help reduce your risk for a lot of these conditions.
Yeah, it's all about being empowered to take control of your own health and staying curious about new advancements in medicine.
You know, speaking of curiosity, there's something that's been on my mind throughout this whole discussion.
Ooh, I'm intrigued. What is it?
Well, we've been talking about how effective semaglutide is for all these different conditions: diabetes, heart failure, kidney disease, even liver disease. And it makes you wonder, are these conditions really as different as we think?
That's a really interesting thought. We tend to think of them as separate things, but what if they're actually more connected than we realize?
Exactly. What if semaglutide is working so well because it's tapping into some underlying mechanism, some kind of common thread that links all these conditions together?
Like we've been focused on the branches of a tree,
Right.
but semaglutide is giving us a glimpse of the roots.
I like that, a glimpse of the roots.
So instead of just treating each symptom, maybe we need to figure out how to address the root cause, the thing that's driving all these seemingly different diseases.
Exactly, and that opens up a whole new world for medical research. Imagine if we could unlock the secrets of that underlying mechanism. It could totally change how we treat and prevent all sorts of chronic diseases.
Wow, it's like we're standing at the edge of this huge unexplored territory, and semaglutide is our compass.
That's a great way to put it.
Who knows what incredible discoveries are waiting for us out there?
It really is an exciting time to be in medicine. It just goes to show that sometimes the most unexpected discoveries lead to the biggest breakthroughs.
Well said. So as we wrap up this deep dive into semaglutide, what's the one thing you hope our listeners take away from all of this?
I think the biggest takeaway is to never underestimate the power of scientific curiosity and innovation. Semaglutide started as a diabetes drug, and now it has the potential to treat so many other things. It just shows that we're constantly pushing the boundaries of what we know about medicine. And there's always more to learn, more to discover, and more ways to improve people's health.
That's a great point. And to our listeners, if you're feeling inspired by this deep dive, don't stop here. Keep learning, keep asking questions, and who knows, maybe you'll be the one to make the next big medical breakthrough. Until next time, keep jiving deep.